at St. Anne's, we document on whether they attend an activity or not, and whether they're passive or active during the activity. Um, if they're active, we can tell whether they're enjoying the experience or not. But sometimes they're passive, which means that some of the patients, because they of the Alzheimer's and dementia and stuff, don't respond during an activity. I personally, I had a patient who I was doing music with, and she had Alzheimer's disease. And one day, during the middle of the activity, she just decided to go into like a sleep mode. She could, we knew she could hear us because she was moving around and stuff, but she would not respond. So it depends on the day, whether on how they respond to the different activities and how they're feeling, and if they want to be involved or not. It's if they don't want to be involved or not, we don't force them to be. It's totally up to them. Like say if they want to stay in their room or not. If they want to stay in their room, they can. If they want to come out to activities, they can also do that as well. They don't force them to do the activities if they choose not to. But as far as documentation, like we document before, like we'll do the assessment and then we'll document how it needs to. Then we decide on who gets into certain activities. We try and tailor it as much as we can to the individual's personal needs. But a lot of the activities at St. Anne's, except for the stuff I do at with the iPad, and some of the other interns do one-to-one interventions in the bedroom, in their like bedrooms. Other than that, I believe the main thing is group activities is what we basically work on, and when we do that, either the interns or the staff document on what we call the ECS, and that's how Carolina. It's called the Electronic Charting System, or ECS, and that's how Carolina documents on whether a patient is going to activities or not, how they're responding in activities, whether they're passive or active. And that's basically how we document. First, we take the assessment tool, and that we originally give them when they first come in, or we do what they quarterly or annually. And then we take the assessment tool and we try and tailor the activities as much as we can to their own personal needs. Like the example of an individual doing a puzzle or something like that. And then we entered into the ECS, and that's how Carolina keeps track of all of the documentation that we do. So that's how we do documentation.